Hello, everyone. Thank you so much for joining us today for this fabulous Birth Center Week event. Birth centers belong to us. We'll be talking all things policy and birth centers. We're going to give folks about 5 minutes to stream into the room. We know everybody is probably running from thing to thing. In our efforts for language justice, today's session will be simultaneously interpreted in both Spanish and American Sign Language. If you would like to access either of those interpretation functions, the instructions are on your screen. We will also drop them in the chat. Julie, would you love to share with us in Spanish some of the interpretation?
Sí, cómo no. Mira, hola a todo el mundo. Si alguien necesita interpretación en español, por favor busca el botón abajo que tiene tres puntitos y escoge el idioma español y también puedes hacerlo en tu móvil, en tu cel. Haga clic en la opción de tres puntitos que dice más.
Hello, all again. You'll just hear this announcement because that's how it goes when people are filtering in the room. But thank you so much for joining us today. You are here for Birth Centers Belong to Us, a policy session looking at what we can do to improve birth center access in the United States. Today, as part of our language justice efforts, we have interpretation in both Spanish and American Sign Language. If you'd like to access either of those interpretation functions, instructions are up on your screen and in the chat, and we will get started in just a couple minutes.
Hola a todo el mundo. Si alguien necesita interpretación en español, solamente debe buscar el globito abajo en su menú y escoge la preferencia de español. También puede usar tu celular. Solamente clic en la opción y tres puntitos que dice más.
Awesome. Well, I think we can go ahead and get started, Julie, when you're ready.
Great. Well, welcome everyone. Hello. I think it's afternoon for some of us, morning for some of us. Welcome everyone. My name's Julie Quiroz. My pronouns are she and her. I am a member of the Birth Center Equity team. So excited to welcome you to day four or five of Birth Center Week. So many wonderful events. It's hard to keep track. This is our second annual Birth Center Week, and we have been so just overjoyed with all the outpouring and all the events and all the extended family that we are welcoming to Birth Center Week. The purpose of Birth Center Week is to celebrate and to elevate the power and potential of birth centers, of all our birth centers, and particularly community-based birth centers. It's also to grow our political, economic, and cultural power as birth centers grounded in with our deepest roots in communities of color. So that is what's bringing us all together for Birth Center Week, and we're super excited to bring you in today to this session. And as we always do with Birth Center Equity, we always return to our values and seek to hold them, embody them, and share them. And those three values are safety, abundance, and liberation. And as we all know, our deepest power comes from our bodies, our souls, our connections to the earth, our connections to our ancestors. So I would invite you to bring your full body in if you would like to join me in a stretch. And I learned this stretch yesterday from Marina Farrell, who folks may know is an Indigenous Latina midwife and the head of Indigenous Birth. And she introduced us to this stretch yesterday, and I'm adapting it a little bit for this. So if you join me, I'm going to push my chair back. Maybe just give your shoulders some love, your neck some love. You might have been on Zoom a little bit today. Yeah, just, feel your relaxation. And if you want to feel your feet on the floor, and just always remember that Mother Earth is holding us. Whether we're paying attention or not, the love is always there. And so here's the stretch. In your chair, standing up, just reach down to the grassroots and just stretch your back, reach down to the grassroots and just feel the abundance and the power of the grassroots. Just bring that in. And then I invite you in any way you can to just reach up to the sky and just feel the energy, the protection, and the joy and the love of our ancestors. And then I would invite you to shake. And we're shaking here, white supremacy, and all it does to us all, forget Layla. Shake off perfectionism, shake off scarcity mentality, shake off individualism, just let it all go. And then I would invite you to just blow in the winds of change, because there is nothing other than change all the time. Blow in the winds of change. And then lastly, just to find your center and just to shine in your safety, your abundance, your liberation, and shine together in all of our safety, our abundance, and our liberation. Thank you. That's about the answer.
Thank you so much, Julie, and shout out to Rebecca in the chat who loved it as well. Hi, everybody, welcome. You are here for Birth Centers Belong. We'll be talking all things policy today. And this session is hosted by Birth Center Equity and Black Mamas Matter Alliance. Birth Center Equity, we are a national organization whose purpose is to grow community birth infrastructure for generations to come. And at our heart is our network of over 40 birth centers led by Black, Indigenous, and people of color. This session is co-hosted, and you'll get to hear from Angela Aina from Black Mamas Matter Alliance, a Black woman-led cross-sector alliance that centers Black mamas, birthing people, to advocate, drive research, build power, and shift culture for Black maternal health, rights, and justice. And maybe you are immersed in all things policy, but you have not yet been exposed to birth centers. We love that. We're here for everybody in this session. So just to briefly share, a birth center is a home-like place where midwives provide prenatal, birth, and postpartum care. They are freestanding and not in hospitals, and community birth centers provide safe, culturally relevant, midwifery-led healthcare for all. And we are so excited for today's session. We have seen a real tremendous growth in the amount of birth centers led by BIPOC folks in our country, as well as midwifery and birth center care being accessed by BIPOC folks. When Birth Center Equity was started in 2020, there were only about 14 BIPOC-led birth centers in our whole country. And now, as I mentioned, we are over 40 that are either in development or open. So it's just tremendous growth and opportunity for both birth centers and midwifery care in our nation. So we have an absolutely incredible panel for you today of experts. And yes, I'd just love to get us started. So for our panelists, we would love to hear your name, pronouns, organization, and your role, and just briefly about 1 to 2 minutes each. What has been your entry point in building access to birth centers and midwifery care for Black, Indigenous, and people of color? And Indra, if you don't mind, I'll get started with you and then we can jump in.
All right. Glad to be here today. Thank you, Birth Center Equity, for hosting this second annual Birth Center Week. This is an exciting opportunity to really amplify what birth centers can be. Indra Lucero, they, them pronouns. I'm the founder and director at Elephant Circle. And there's 4 entry points that are very relevant that I'd like to share. The first 3 are very tangible embodied experiences with the power and resources and beauty and joy that birthing people bring to the experience of pregnancy. First is my own experience as a queer, genderqueer person who gave birth with the support of a midwife at home 21 years ago. And just experiencing, knowing that as the best healthcare I ever had, and to this day that remains true, that it was the best healthcare I ever had. But then also I'm the oldest of 4, and my 2 youngest siblings were born at home after my mom had a traumatic birth with my sibling who came right after me. And so that really defined my understanding from a very young age about the importance of the centrality of the birthing person and the things that birthing people have to do, sometimes to step out of the system, sometimes to sort of reclaim what they know they need. And the third thing is getting to grow up in Colorado, which is very near to where my ancestors on my dad's side have been for many, many generations and years. And getting to know, getting to see and be and look around in the place where my great-grandmother gave birth 12 times, and seeing what's, it's high desert plains, very remote. And, we could spend a whole other webinar talking about that region of Southern Colorado, Northern New Mexico. But suffice it to say, it embodies the tensions of this country and colonization and racism. And to sort of be able to be there and think of her and know that I'm connected to her birthing is part of what leads me here. Finally, then, I went to law school specifically to develop an expertise because I wanted to understand all of this. And it sort of culminated in a private equity company deciding to abandon a birth center in Colorado, and Elephant Circle at the end of 2022 decided to step in and see if we could revive it, keep it going. So I've also been very much in the weeds of running a birth center. So I'll close it there. Thank you, Denicia.
Absolutely. Angela, would you like to jump in?
Hi, good afternoon, everyone. And thank you again to Birth Center Equity for a wonderful Birth Center Week campaign. My name is Angela Ina. I'm the co-founder and executive director of Black Mamas Matter Alliance. And I use she, her pronouns. And I will more so talk about Bima May's journey into the work that we've been doing with birth centers and midwifery care and some of the policy advocacy work that we've leaned into over the past few years, and mainly because I too have some home birth stories, but it's more so stories of my siblings, and I want to get that permission first before I share that out. But thank you, Indra, for that, for sharing that personal story, because in this moment, it just reminded me like, I need to talk to my siblings to see if they want me to share, and my mom too, because the personal is political, right? And it is a lot of the reasons why we get into this work. But for BMMA, our journey in building access to birth centers and midwifery care has been transformational and pivotal, mainly because we've been deeply committed to advancing Black perinatal, maternal, and reproductive workforce, in particular with our work. A lot of times when people hear about BMMA, they sometimes automatically think direct services, or that maybe we provide direct services to moms, babies, and families. But more so, I always like to let people know that we really do see ourselves as a global platform for the Black perinatal, maternal, and reproductive health workforce. And so when we talk about research, policy, culture shift, and advancing care, it's about that workforce and everything that is needed to support and expand our workforce, right? And so that commitment has guided our efforts to address a lot of the systemic barriers and challenges faced by birth workers, particularly those from marginalized communities that are often excluded from the workforce due to restrictive policies, whether those policies have to do with certification access, or getting finances to support your education, or even the ability to just practice to your fullest scope of your licensure, right? And so through our policy and advocacy work, we've really focused a lot on advocating for policies that respect and elevate the standard of care, and particularly that's provided by Black midwives. This includes like working on, like I said, issues around licensure, regulation, and even reimbursement that accurately reflects the value of their work. We also engage with legislators to introduce and support resolutions and legislation that recognizes and support Black midwifery, such as the Black Midwives Day, in collaboration with the National Black Midwives Alliance and Community Midwives Act, in particular here in Georgia. We've done a number of convenings in the past. In 2020, we brought together a lot of our partners in the Alliance virtually to really discuss a lot of these issues around just not only access to midwifery care, but what are a lot of our Black midwives and even student midwives, what are they experiencing? What are those challenges to how they could practice? And then also having really honest conversations and hosting collaborative conversations with folks who have started birth centers or who have expanded their community-based organization to include or to try to become a birth center as well, and like hosting those conversations to understand lessons learned, best practices, and just the reality of what a lot of our Black-led birth centers are currently going through. And so we did that and created some issue briefs over the years, and we're going to continue to develop and disseminate those issue briefs. And then most recently, as of last year, we collaborated with or partnered with Center for Reproductive Rights to host a Black midwifery convening here in Atlanta back in February of 2023, where we brought together a diverse range of midwives, including certified nurse midwives, licensed midwives, traditional and direct entry midwives, just to, again, further understand where are these how can we come together and have just a standard of policy areas that we can all agree upon that's non-negotiable. And so we're still working on those efforts and continuing those efforts. But the thing that I do want to highly lift up is that we were finally able to release our comprehensive policy agenda that it took us 4 years to pull together, but we finally released that in 2023, and we've been disseminating it ever since. And so we do have sections in that policy agenda which really uplifts and centers what we're wanting to see at the state and federal levels around more support around birth centers, more investments, and then also more particularly policies and healthcare administration policies that supports the function of birth centers in our communities, especially communities most impacted by what is considered maternity care deserts. And so I'll stop there. Thank you.
Thank you, Angela. And for folks to check it out, we dropped the policy agenda in the chat. Make sure you read that super valuable resource. So I am incredibly excited. We have such Southern representation on the call. So I would love to head to Alabama and Dr. Heather Skanes.
Hi, everyone. My name is Heather. I am an OBGYN, and I am the founder of Oasis Women's Health and the executive director of Oasis Family Birthing Center here in Alabama. So Oasis is the first operating birthing center here in Alabama, and we've also been the first to be licensed and now nationally accredited. We have done a lot of litigation working with the ACLU to kind of overcome some of these regulatory barriers to opening birthing centers here in Alabama, which has been an ongoing battle for a number of years. And so one of our goals is, our main goal in opening was to increase the number of people using out-of-hospital birth as an option, but also to be a training ground for midwives, particularly midwives of color who were looking for preceptors to train them in out-of-hospital birth. So a lot of work to push the midwifery education, as well as to increase the collaboration between physicians, nurse midwives, and professional midwives here in Alabama, kind of destigmatizing midwifery here. All right, that's all.
Thank you so much. And let's head over to Mississippi and Tanya.
Hello, everyone. Happy to be here. I'm Tanya Smith-Johnson. I am a CPM midwife based in Biloxi, Mississippi. I'm also the president of the National College of Midwifery, that is a direct entry midwifery school that's based in New Mexico. And I'm the executive director of Birth Future Foundation, a philanthropic organization. My entry point has been as a consumer, and I center all the work and advocacy I do around that, more so than coming from the point of a midwife. Yes, I'm a midwife, but it's always about the consumer. And as a mother of 6, I birthed with all midwives, but in various settings. The first in the hospital, and then 2 in a birth center, and the other 3 at home. So I know the beauty of what out-of-hospital birth can do, on a very cellular level. And also what birth centers can be. And previous to that, though, I call myself a medical school dropout. I thought the entry would have been being an OB-GYN, but going in as a new mother, a very new mother, like 2-week-old newborn, realizing like, oh my goodness, like this is not where it's at, right? Like the way I was treated as a medical student and the way I was being trained very early on, I was like, this can't be the future of maternity care and healthcare in this country. So a huge pivot, and it took me a minute. And in the midst of that, midwifery was calling, and I had babies and I experienced the care, and it all just kind of made sense one day, like, oh, I'm supposed to be a midwife. This is what I'm supposed to be doing. And I always thought that was going to look like having a little old school doctor bag and going to people's homes. And once I realized like, that's not how this goes, like, I realized like, okay, so it's my, mission to, not only bring back midwifery for the South and, do my part in getting more midwifery students here who can really carry on that tradition, but also making sure that it's accessible to all of us, whether you have insurance or not, whether you can pay out of pocket or not, it's crucial. So, and we'll get into, the whys when we get further into the questions, but happy to be here, and I'm glad we're having these conversations.
Thanks, Tanya. And Shanti with the incredible RJ Org Sister Song. Will you bring your voice into the room?
Sure, thank you. And thank you for having me. My name is Shanti Moore. I use she, her pronouns, and I am the Birth Justice Training and Curriculum Coordinator with Sister Song. Sister Song is a national women of color-led reproductive justice organization. And when I think about my point of entry, Angela, I hope you don't mind, but I'm going to put you on the spot for just a moment. This was back in 2017 when we were first learning about the maternal mortality statistics affecting Black and Brown women. And we were at a town hall discussing, having conversations about this. And I was a new doula at the time and very fired up. And I remember having a conversation with you after that town hall because I was vacillating about which path to midwifery I wanted to take. And although I was a nurse, I had no interest in working in a hospital. And I remember you told me, go to school and get licensed anyway, because we need you in these spaces. And this is a full circle moment because this week I am completing my degree to become a certified nurse midwife. And I get it. I understand why you told me that, because for one thing, you can't have birth centers without licensed midwives. So I'll leave it there, but was a very crucial point of entry. So thank you for pushing me off the fence.
Thank you, Shanti.
That's so beautiful, Shanti. And we all offer our incredible congratulations and are ready for the celebration. I'll briefly bring myself into the room. Venicia, I use my name, not pronouns, and just want to share that all of my nibblings, I'm a Thea of 4, have been born to midwives and birth centers or at home. And my grandma was born to a midwife, so I'm incredibly proud of that generational legacy, that midwifery only ended for one generation in my family, and hope it continues for generations to come. So with that, we would love to jump in with some individual questions for our panelists, open it up to the panelists. And yes, we are talking all things birth centers, midwifery today, but would love just to hear a little bit about what is some of the context around maternal and infant healthcare in our country? So what are things looking at that, we really need to reshape? We need to reshape to more midwifery care, to more birth center care. What does that look like? Angela, if it's okay, I'll start off with you and we can pass to other folks.
Yes, so definitely in terms of just thinking about our current landscape, I know that we all know the standard statistics around the maternal mortality rate in the US and the fact that it's still rising. We have seen a slight dip in that rate in the last few years, but nevertheless, the disparity still persists. But what I really more so want to uplift is the fact that what's really concerning is that our healthcare system is disastrous. That's what's the crisis, is our healthcare system and the policies around the ways in which we just are able to even just get healthcare in this country. That is the crisis. And I really need for people to remember that and stop saying Black maternal health crisis or maternal health crisis. No, it's the system. It's our system that's in crisis. And so with that being said, March of Dimes put out a report, and I think they just updated that report that showcases like lots of regions across the nation that just do not have facilities for any kind of maternity care. In our particular state of Georgia, we know that over half of our 159 counties in Georgia have no access to OBGYNs. 66% of Georgia counties do not have access to midwives. Even though CNMs are allowed to practice, but that's more so in hospital in our state. 35% of Georgia counties, again, are considered maternity care deserts. And we know that 61% of Georgia women live over 30 minutes from a birthing hospital. This is on top of the fact that We have since 1994, over 41 labor and delivery units have shut down across the states, with 9 hospitals being closed since 2010, including, unfortunately, Atlanta Medical Center in October of 2022. These are places that have provided vital and very important maternity care services. And then you layer that with the reproductive health restrictions, so the abortion bans that have now made a lot of these maternal and infant health outcomes even further worse. And so that's what we're grappling with currently in our nation. And I'll pause there.
Does anyone else feel like jumping in on that question? If not, I'm happy to keep going. I mean, Angela laid it out fabulously, so absolutely. So Indra, I'd love to turn to you, and again, folks can jump on this one as well. But would just love to know more. What are some of what is one barrier, one opportunity you see for birth centers in the policy landscape? And I know that Elephant Circle provides a lot of technical assistance to folks across the country. So if you have examples from different states, we'd love to hear that.
It's hard to whittle it down to one, but the primary barrier, to sort of simplify it, is that the entire infrastructure for maternal health was really designed around the hospital. Literally in terms of buildings, in terms of roads, but everything from policies that require infants to have an identification bracelet to certificate of need, or like when can there be construction related to health services, and everything in between. That's a barrier, not just for obvious reasons like nobody thought to, put a birth center on this chunk of land, but because when somebody does, like I know Dr. Skanes, intimately, you'll bump into all these things that just weren't even designed to anticipate birth centers, and then can be used to work against them. Even if nobody's trying to be hostile, it's hard enough just because essentially there's not a drop down menu item for that. That's like best case scenario. Worst case scenario, though, it's when there's not a drop down menu item and then somebody exploits that to just push people out, keep birth centers out, keep midwives out. So that's in a nutshell the nature of the barriers. The flip side opportunity is, I think there's a real opportunity to know and learn this history, because I think when we do, we can see that where we're at today didn't happen by accident and it didn't happen magically. When we know that and we can see how the pieces all lined up, I think it's a real opportunity to then see how might we counteract that. And I think, in short, we counteract that by investing in infrastructure that supports midwifery and birth centers. The infrastructure that got us here was heavily invested in. Billions. And I think we can make a lot of progress even by investing millions. Every investment in this infrastructure takes us from essentially zero to something. And so that investment is a true, profound, and significant opportunity. I think I'll pause there because there's so many places that we could get into the weeds, but if you do have questions, perhaps later that would be a place where we can get into some of those weeds.
That sounds great, Indra, and love how you and Angela both really laid out, this is about systems that have been operating, for decades, for generations, and what that looks like.
I was just going to add to what Indra said, which is one of the major issues that we run into, not just in Alabama, but anywhere, is that I think the general public understands the crisis that we're in, and they're being affected, and they understand, they see what's going on. It is the people in power don't seek to understand or change anything about this current infrastructure. And I would say that even if you are not quote unquote hostile as a person, if you uphold unjust systems and regulatory barriers, you are in fact an oppressor and you are hostile to the people. So people say things with a smile, which is very common here in Alabama because it's, polite Southern, but you are upholding an unjust system, whether you are intentionally or unintentionally harming people, you know that there's harm being done, and you continue to uphold this system because it's the status quo for you. And that's what we commonly see, is that the people who are in a position of power to make significant change refuse to hear from those who know the most about what changes need to be made, and from those who are being affected by the lack of those changes.
Absolutely. Thank you for that, Dr. Skanes. So Tanya, I want to head to you and just ask you, what does the Deep South need as far as policy, infrastructure, workforce? Angela talked about this is a real crisis across our country, and we know there's disparate impacts in regions of our country for different populations. So what does this look like for the Deep South?
Yeah, I'm glad you asked the question. And I think this is like the perfect segue from what Angela was talking about when she was talking about various different regions. And if we really care about, Black birthing people, right, we really have to focus on the Deep South. It's where Black people are, plain and simple. It's not rocket science. And I think, we focus a lot on blue dots in these places or urban centers. And we really need to think broader and think about, where are Black people at? What do they need? What is there? And the Deep South is a place where it's going to be difficult. It's going to take some real intention and a real strategic plan to think about all of the various things. The first being policy changes, right? Making sure that midwives can practice, but not only practice, but practice autonomously, practice outside of the hospital. Before we even get to the birth center part, right? We can't even think about a birth center until we think about what needs to be in place. And then also thinking about even thinking forward, like, what does that language need to be to allow for birth centers, similar to what Indra was talking about? What does it need to say and be ahead of that curve before we even get there? Mississippi, community midwives, CPMs aren't recognized, but we can still do births. We can register with vital statistics. It's not anyone trying to necessarily stop us. But we're surrounded by states that do. Louisiana, Tennessee, and Alabama all, recognize CPMs now. So it's prime to focus on okay, it is coming to Mississippi sooner or later, whether we're the ones who, write the bill, who push forward, or it's ACOG and AMA who's going to do it, right? So thinking about what that should look like and looking at other states who did it well or not, or the things we do or do not like about those bills and that licensure and policy, and make sure that we're fighting for that, here in this state. Also, just realizing that we need to, refocus on, rural, spread out areas like what's here in the Deep South, right? Maternal deserts here are the norm, right? There are people who drive an hour to 2 hours to see a doctor or a midwife, right? Sometimes I have clients calling me, across state lines, where my radius as a midwife has to be at least 3 hours because I'm the only Black midwife down here. Mississippi has 3 CPMs, and we're pretty much dividing up the whole state, and it's just not sustainable, right? So the next thing I would say, we really have to think about what the workforce needs to look like in order to support and sustain a birth center, right? We need nurse midwives, and we need community midwives, and they need to be able to work collaboratively also with OB-GYNs. And I think there's opportunity here in the South because we're so desperate and there's so a lack of infrastructure. There's a lack of anything to where there are doctors, there are folks who are like, hey, let's be creative and inventive. What can we do? Because we have so many, counties and populations that have nothing, that we actually can build something that's really, pretty genius, but we have to make sure that the policies and the legislation and the laws allow for it. And then too, even thinking about that, and then thinking about, where are Black people at? Black people, in this state, a lot of them are on Medicaid. So we can't think about midwifery and just think that people can pay out of their pocket, right? They cannot. I have clients who can only pay $250 for a midwife. And we know that's not sustainable, right? But that's where people are. So we have to meet people where they're at. So we even have to think about, Yes, birth centers, but how are they going to pay for it? Who's going to work in them? How are we going to reach community? Where does this birth center need to be centered so that people can have access to them, right? So it's all of those things on layered upon layered of all the other larger things that we see happen in other regions. Maternal mortality, of course, maternal deserts, food deserts, environmental deserts, all of these things. And then we're in a region where that gets hit by storms, right? So what happens in emergencies? You know, when there's no infrastructure, there's no hospitals, there's no teams down here. So I think, you know, we're going to have to, you know, in the ways in which we think about other countries and, you know, we want to go and help them out, like that is the Deep South, right? Like we have to get really like, who are the teams or folks? I even say like, it's going to have to be like the Underground Railroad of midwifery here, because we're going to have to piece it together. There's no preceptors here, right? So how we even once we get the students into school, we can pay for them to go to school. Who's going to train them and where will they be trained? So all of those things need to just, you know, I feel like we need to zoom out and have a real solid strategic plan that thinks about all of the things that impact the Deep South and how do we get where we need to be.
Absolutely. And I just want to name in the chat, we have Elmitria saying that they are feeling you from Tennessee as well. Huge maternal deserts in Middle Tennessee. It's awful, needing midwives, OBs, doulas, and community health workers, needing the full spectrum. So, you know, just some resonance there as well. Yeah, states not wanting to pay a sustainable wage through Medicaid or other folks. Absolutely. So Shanti, we heard that you were graduating this week, which we love. And you know, birth workers themselves, ourselves have been a transformational force for change. You know, we have midwives, we have doulas, we have lactation consultants getting involved in policy work. What does it look like for midwives and birth workers to be getting involved in policy change?
So I think for starters, for midwives, birth workers, clinicians who work with pregnant people, clinicians, period, especially in our current legal landscape, as it pertains to reproductive health, we have to understand that our roles are political. It's no way around it. That if you want to be a good healthcare clinician, you have to get involved politically, because that's just where we're at. I think also something that comes to mind is a quote, I'm going to butcher it a little bit, by a midwife by the name of Pandora Hartman. But I remember she said something that stayed with me, that midwives have to, in other words, free themselves from the perineum. Like, don't be so married to the perineum that you think the only way to be a midwife is to catch a baby. You know, that there are so many other roles that midwives are needed in, you know, especially around policy change. So thinking outside of the box, and also because these are things that help to expand the profession, you know, so getting involved in policy, epidemiology, research, all the things. And then also, I think it's important to name and recognize that for any midwife or clinician who is providing direct care services and they're working 40 plus hours a week, you don't have time to go to the Capitol. You don't have time to really advocate in the ways that it's necessary, you know, and coming out of having done clinical rotations, one of the things that I've observed, and I would love to see some policy change around, is the way that the day is structured, the way these visits are structured. First and foremost, for the clients and the patients, a half an hour is not long enough for a prenatal visit, you know, and those are birth center standards. But also when we're looking at the clinician side of it, you know, clinicians a lot of times have their schedules piled, patients piled on top of one another, you know, and I know that a lot of it is connected to the finances of everything, you know, but we have to reconsider what these days look like for the providers as well as the patients, you know, because providers can't be good advocates if they're burnt out. They just can't. The last thing that I want to say is that I feel like midwives and OBs really need to get together in terms of collaboration and understand that we need each other. we can't work without each other right now. Like what you said, Tanya, I hope I'm saying your name right, in terms of the Underground Railroad, like we need all hands on deck. Everybody has a role that is vital and important to changing what's happening right now. So that's what I'd say.
Can I just jump in real quick to underscore that, Shanti, you just said 10 things that we found in our landscape analysis. So I'm putting the landscape analysis in the chat. We interviewed 30 people from across the movement, did a survey, and I think it can be useful as a tool as folks try to sort of make sense of, what's happening in this field, because there's common things: burnout, the need for collaboration, financial instability, a lot of the things Shanti just said, we amplify in that.
Absolutely. And I'll mention several of the folks on our panel are working clinicians. So unfortunately, Dr. Skanes had to jump off. We did have a fabulous question in the chat, just an update about the lawsuit that Dr. Skanes and others in the ACLU brought in Alabama. They were successful in challenging the Alabama Department of Health regulations, prohibiting birth centers. So just incredible, exciting victory there. I think Dr. Skanes mentioned that she is, the birth center is now ready to operate and ready to go. So we'll make sure that Birth Center Equity and BMMA can reach out to her. Maybe we can do a live in the future, because we absolutely want to continue to learn from her expertise and leadership there. And are just thankful too. She is somebody doing the work, as a physician, collaborating with all types of midwives in Alabama to extend access to this care. So thank you to her, and sorry we had to drop off, and I know we'll have folks doing that as well throughout the call, so we'll just work with it. Reminding folks in our audience to drop additional questions in the Q&A, in the chat. We'd love to hear from you guys. Obviously, as you guys can see, we have some of the best experts in the country on this call, so would love to get a chance to get your questions answered. But yes, I would love to go a little bit into, folks have definitely talked about payment here, how midwives are not getting reimbursed enough, how care is not sustainable or affordable for our families. But I would love to hear from anyone. What are some of the financial barriers that birth centers face in seeking reimbursements for services, and how does that impact access?
Maybe I'll dive in because we've got this birth center that we're trying to keep open. One of the biggest economic financial barriers is that payment in most places, I don't think there's a state yet that's doing very much prospective payment, but payment usually happens after services have been provided, and usually it's well after. So you have to figure out how to have a business model that allows you to pay people, because you need them to keep showing up to work, you need them to be there before you're bringing money in. So either that can come in the form of some sort of initial investment, or it's like financial instability. And then it's very precarious if anything changes, which is one of the things we're facing. There was a system-wide data breach in February, which meant a number of billing systems across the country just got bogged down, delayed. So here it is, September, and we're still waiting on payments that would have already been slow anyway, but we're still waiting on, hundreds of thousands of dollars of bills for services already rendered. And that's just like as if the reimbursement rates were actually equitable or even adequate. And they're neither of those either. So it's compounding layered economic problems. But again, it's because that whole infrastructure was not built for birth centers. It was definitely built for big health systems. And this is part of why health systems are consolidating, because the way that this works really advantages consolidation. You can weather these sort of fluctuations if you have tons of things that you're billing for. If you're, you know, if you can bill for the foot surgery and the eye exam as well as the perinatal services, it just makes it easier to deal with these facts. That's a little overview from my perspective.
Well, I'll talk as a midwife, and, you know, in the opposite why, you know, some midwives probably don't want to, or probably will never open a birth center, right? Because just thinking about that overhead, just thinking about all the things that need to be in place, right? As opposed to being able to stay a home birth midwife. I don't need an office necessarily. I just need my car, my bag. I can do my visits with, you know, with the client. But even that, you know, has its limits. You know, lots of midwives have sliding scales, and they will slide all the way down to, you know, to basically nothing, or even taking, you know, people, you know, just kind of pro bono, right? And even that's not sustainable, right? Like just not having any of those other expenses and literally just, you know, doing that level of work where, you know, similar to, you know, what Shanti said, like, yeah, our appointments are not 30 minutes. So they're hours. Sometimes I'm spending 2 hours with people. Sometimes I'm sitting there with them while they take a nap, and I make sure they eat, right? And all of that time, right? And so midwifery kind of has been built on this idea of it's woman's work and it's heart work and it's care work. So we just give and give and give, without thinking about like all of that is energy, all of that is time, all of that is something that needs to be paid for, right? So even like, you know, just, you know, as midwives trying to conceptualize, like, what does it look like to actually have a birth center, and what does that, you know, what does that require? What does it need? But also thinking about it as a business, you know, and lots of times midwives we're great and loving, but we're not business people, right? So oftentimes people jump in, you know, straight into thinking like, I'm gonna have a birth center, and not knowing all of the restrictions and the limitations and what that means, payroll and billing and all of those things, right? So in my mind, it would be beautiful for places who haven't even gotten to that point, like for me, like here in Mississippi. What for those who are in other places who've done it already and seen all of the, had to blaze the trail and chop things down with the machete. For someone who's coming up behind them, what does it look like? What is the blueprint? What is the playbook? What are the things that need to be asked for? What are the structures that need to be in place before we even think about, opening the doors of the first, birth center in Mississippi? What do we need to be thinking about? And I think those are things that as midwives, we don't learn it, definitely don't learn it in school, right? How do I have a sustainable practice? How do I take care of myself so I'm not burnt out? How do I set hours? How do I, set my fees? What are all of these things I need to not be burnt out as a CPM who graduated and is no longer practicing 3 years later, right? And I'm sure there are landscape and impact reports that talk about how long midwives, really practice. And so all of those things are the things that we need to think about, because if we build it and people come and we're constantly running through folks, then what does it mean? And really what's the impact on community when that happens? Or, our opposition saying like, see, told you that doesn't work. Look, they're not here long. They don't even want to really do this, So again, part of that, just in my mind, this kind of big picture strategic planning, seeing like where people at on this kind of timeline. California has got it figured out way better than, we here, in Mississippi, right? What are the lessons learned, and can we figure that out and figure out where states are at, and what do we need to do so we don't make those same mistakes, or we're thinking proactively about what's needed.
Absolutely. Thank you both. Oh, go ahead, Indra.
I would just amplify that kind of network is infrastructure. Like, knowing that other people are out there, they know what we're doing, they understand the value, they're invested in the value, even if it's not with dollars, they want to see it happen, they believe in it. Investing in that kind of infrastructure is part of what we need to make these models of care viable. And we can do it in a way that's not, the model, of course, with health systems is exploitative, and it centralizes gain into the hands of a few. But there is a way to build infrastructure and have networks that don't do that don't hoard resources, that actually redistribute them or distribute them equitably.
Mm-hmm. And we have Sandra in the chat saying they have major challenges in California as well. And yeah, unfortunately, it's the reality for most states. Myself based in New Mexico, we have some of the most supportive midwifery laws in the country. And that still doesn't mean midwives are paid well or that communities of color can access birth care. Like legislation, administrative policies does not ensure access. And we really need to see what makes this work, of course.
And I'll just piggyback on that. So that just shows you how dire it is then. If a place like California that has all the money, all the resources, all the attention, and there's still these issues, what does it mean for a state, that's majority Black, right? Who doesn't have the resources, who doesn't have the attention, who doesn't have the activists and the midwives and all the folks or the infrastructure screaming, saying this is what we need. So even taking a place that is doing better than another and saying like, this place has issues, so what does it look like for this place here? So how can we prioritize what needs to happen?
Absolutely critical, Tanya. It's not the same in different regions and what that looks like. Absolutely. So we have a question from Gabriel Outlaw in the chat. When it comes to surveys and data, how do you inform, collect information, and put it out in meaningful ways? Angela, do you maybe want to take that one first? I know you guys publish incredible reports, so.
Well, for the most part, in terms of collecting data, especially in this area, I do think that it needs to be rooted in partnership and collaboration first and foremost. We do, separate from our policy agenda, we also have a comprehensive report that talks about what it looks like to have ethics and values around and principles around research and data collection, especially in Black maternal health, and that's on our website. But on this topic in particular, I do think that it's the data and information is going to need to be more expansive. So I do love what Elephant Circle has put out and some of the work that you all are doing as well with, and I feel like I'm going to butcher it, but you all had some tribunals and did some wonderful work around just bringing in everyday people, families, and folks who care about these issues and bringing them in the space and talking about like the data and information in a way that's digestible for folks to then spread it out, and hopefully that also might have invigorated people to become advocates, right, in their own arena and think about ways in which, please, you all vote. Listen, I'm going to kind of go all over the place, but where I'm landing is that from data to information awareness, please vote. But I will say that data and data collection, especially in this area, has to be rooted in intentional collaboration and partnership. It needs to be mixed methods as well, collecting stories plus the statistics. It can't just be epidemiology and stats alone. Yeah, but I'll pause there because Idra, you probably have some really good insights here as well.
I think it's partly about knowledge translation, which is, a term that academics use, but I've come to like it because it is what it says it is. I think on these issues, we don't actually need any more statistics. I think we've got the data we need in terms of what's the nature of the problem, what's the nature of the solution. But what I think there is room for is investing, again, because it's infrastructure, investing in taking the knowledge that we do have and translating it, communicating it in dynamic ways so that you can get a range of audiences engaged. Because again, that's one of the things that helped build the existing infrastructure. It was investment in a certain knowledge translation. It, I would say, was a terrible one. We could point out all the flaws of the data and how data was used to create ideas and ideology, basically, that has been harming, that is absolutely contributing to the problem we have today. But that's part of the thing. We don't just, again, we don't just need statistics. We need stories. We need values, and we need to communicate our values through stories. And again, like you said, in partnership, in community, because that's where the meaning comes from.
Absolutely. And people are hearing you in the chat, Indra. Rosalie says, I agree with Indra. We need the investment. And Almitra said, Elephant Circle's great. They hosted a tribunal in Memphis. So, and Indra dropped more about the tribunals in the chat if folks are interested in checking that out. We have a question from Terry with the Missouri Foundation for Health. I'm interested in the narrative change comments. So at what level of narrative do you think advocating for birth centers makes the most impact?
I think at all levels, but definitely in this case, one of the things that I do think needs to happen around is hearing more narratives and stories of the workforce themselves. So we do need to hear more from birth workers, midwives, and folks who have birth centers, people who are trying to work and be more connected to, even in their local region, some of the hospital systems. So for example, there are points of intervention just around continuity of care. And even if that is like the lever, if you will, the policy lever that helps just create some level of change, that's something. And so it's like being able to amplify local success stories and sharing that with policy and decision makers so that they can be thinking more broadly and in a way that at least opens the door for better investments in our communities around access to quality health care. And so I do see that as being very impactful and as a way to, like, especially for some of us in states where our legislators, if you come in just saying birth centers, they just shut you down. You know, being able to come at them from a different angle and showing like return, you know, the language that they like: return on investment, cost savings, you know, blah blah blah. Even though, you know, we all know, hey, it saves lives. It's good for the environment, you know, yada yada yada. But you know, so unfortunately, we got people in power who don't care for those things. But again, being able to amplify narratives of collaborative partnerships that is community-based and community-led. I will say that that's the important part, you know, not just mainstream organizations that got branches in different areas and then they're claiming to be community-based. No, true community-based that's led by people that are most impacted, who are really doing effective work at the local level, and then finding out ways that that can be utilized as as a way to leverage it for policy change, I think is impactful.
Absolutely. And we love that question, Terry, because we know we can make change at the legislative session. We know we can do administrative rulemaking, but that research, culture shift are critical to making that change as well. So I just want to ask all of our panelists, you know, we want folks to be able to take action after this session, which can be tricky for people that are new to policy, you know, what that looks like. So what's one action, and I know one is hard, Indra, but that people can take today to support the growth of birth center care? And Angela, if we can start with you. Oh, you have to drop off. That's okay.
No problem. One of the actions I'll say is please download our policy agenda. We have a lot of great recommendations there, and I'll just say a few that we have highlighted that we want to see happen for birth centers. Of course, we want to see more access, increased access to birth centers by expanding midwifery licensure licensure and access, and increasing those reimbursement rates. And then, of course, increasing reimbursement rates for birth centers, including provider costs, and making more investments into birth centers by actually creating funding streams, especially public funding streams to support birth centers, dedicated funding streams for birth centers, and creating a robust and sustainable funded community birth center accreditation system that excludes the burdensome requirements of the current accreditation system. So those are some of the things that we have highlighted in our policy agenda that we believe will be supportive of, again, increasing birth centers, especially in our communities. And thank you all again so much for having us here today. And, we continue in this fight for reproductive justice and birth equity in our communities. Thank you all.
Thank you so much, Angela. We'll see you soon. So Tanya, what is one or some actions that people could take today in the future to support the growth of birth center care?
Yeah, I hate to be that person to say it, but yeah, we got to vote, y'all. And that's specific to this year, but like there's so much on the line. And when I say that, I mean like on the smallest level to the largest level, like city council, your local government, your state, all the way up. Because the one thing our opposition has done is been very patient. They've been very strategic. They've been planning, and they've, to Indra's point, been funding and investing in awful things, but it works, right? So I think those are lessons to be learned, that we need to be very strategic in what we're tackling, what we want, how we get there. That does take planning. It does, take folks like, who have the time to be at the Capitol, to look at your state list and see what legislation is being introduced in this session. And if any of it, even if you just type in maternal health, reproductive health, or whatever, births and whatever you want to type in to find, those kind of legislation, and be there to see what it is and testify, make comments, all of those things, because it matters. As someone who's done lots of policy work in lots of different states, your voice does matter more than you think. I know a lot of people think like they don't want to hear my story, they don't care, but I tell you right now, legislators have actually told me when they heard that person's birth story that said the thing that touched me, and then when you have multiple stories coming in, they do listen. And also, especially if you're one of their constituents, you're in that person's district, they want to, and they're supposed to do whatever it is that their constituency wants. But even in a red state like this, right, sitting down with legislators, some of it, they're, to be quite honest, they're kind of idiots. They don't know any of this stuff. Like we went and they didn't even know midwives could take blood pressures. We're like, really? Like, oh, we're on that level of like knowledge about what we're talking. We thought we were going to be able to walk in and have this kind of high level conversation about what's needed. So we're like, oh, okay, so you all need to be educated on the difference between a doula and a midwife, or the types of midwives. That's where we're at, but that's what it takes. So those are some very, simple and easy things that may or may not cost a lot of money if you can get to your Capitol, or you can get to your local office to talk to folks. But also, yes, like we have to, I always tell people this policy is made up by, made by people. Infrastructures, institutions are made up of people. So it matters who are there, because those are the people who make policies that dictate our lives. Like we don't get to opt out. We don't get to say like, it doesn't matter, right? It does matter. Every little thing that we're seeing happen and being, disrupted, sabotaged, are all things that people have, intentionally done and showed up for and advocated for. And we have to be willing to do the same for our side. Fight the good fight.
Shanti, actions people can take to support birth center care.
So I want to echo everything that Tanya just said. And also just to encourage people, just show up. If you can show up to your state capitol, show up, because it's an interesting that happens. I had an opportunity to visit my state capitol. I'm here in Atlanta, Georgia, earlier in the year, and it was my first time witnessing a session, just seeing what goes on the floor. And it was so interesting. Everybody wanted to know who I was. All these lawmakers, who are you? This is a new face in the space, because they wanted to know, how was I going to influence the work that they were doing? even though they did not know me. So I'm saying that to say, general public, do the same thing because your presence is important. Even if you don't know all of the ins and outs, start showing up because just you being in the space matters. People begin to pay attention.
And show up with your babies too. Bring the kids, make it a field trip, whatever you need to, especially when they see babies and kids and all the things. They're like, what is going on here? Like it's, yeah. And I say it's my special trick or something, but I'll bring all of them. And they sometimes they have talking points, like, and they're like, oh, let me listen to you, young man, you know. But yeah, like show up, like going to session matters. So thank you for saying that, Shanti.
Definitely. And if I could just make one more point, become an advocate for midwifery care because birth centers follow a midwifery philosophy of care. So whatever that looks like to you, start advocating for midwives.
Absolutely. Love both of you bringing that. I know in New Mexico, when we were advocating for expanded licensed midwifery care, you know, we were facing down the medical society and the medical board and a really tense hearing. And then all the parents rolled up with their strollers and the crying babies and the yelling kids. And it totally changed the dynamic. And everybody started telling their midwifery stories. So these state houses, our Capitol buildings belong to us and our families. So love that reminder. Indra, do you wanna wrap this question for us?
Also definitely echo and really, you know, my suggestion is really along these same lines. Two things I'll mention. One, just wherever you're at, whatever your location in this space is, whatever you do, kind of scan and see if you can identify one of those pieces of infrastructure that maybe wasn't built for birth centers, and just consider, what if it did? What if it did work for birth centers? What if it really did work and centered the birthing person? What if it really worked for midwives? That one little piece of infrastructure. The other thing, I think, really just to amplify what Tanya and Shanti are saying, I want to share this little story. One of my favorite from the history of, you know, perinatal care in the US. In the 1970s, there were some legal challenges because it was common that fathers were excluded from labor and delivery. And it started to be an issue that communities cared about. It's just started to be more of an idea that maybe dads could be there and hey, maybe dads should be there. And in the 70s, those legal challenges failed. To this day, there's not good legal precedent supporting the right of dads to be at labors, but culture changed. And it's now common, and it is common policy in birthing facilities across the country to, like, that's not even a question anymore. And that's a fairly short time. We can change policy like that too. Sometimes it happens in courtrooms, sometimes it happens in legislatures, and sometimes it happens through, you know, people changing what they expect. And so I would just say, let's expect the infrastructure to work for birthing people, for birth centers, for midwives.
Absolutely love that, Indra. Well, I am going to drop something in the chat, which is that Birth Center Equity worked with Representative Robin Kelly from Illinois District 2 and Representative Young Kim from California House District 40 to publish a congressional resolution in support of Birth Center Week. And like we've all been saying, change happens in a million different ways. This is a culture shift piece we put out to say midwives and birth centers are in our communities. They're being led by BIPOC folks. They're changing the dynamics, welcoming babies into our communities, and we want that recognized and acknowledged. So I'll just put out to our audience, if you want a conversation starter with your federal representative or senator, with your state-based representative or senator, with your local county commissioner, you can use this resolution as a starting point to that conversation to say, hey, we just celebrated Birth Center Week, and I want to talk to you about midwives and birth centers and being able to start those conversations. And we're deeply thankful to Representative Kim and Kelly for starting that conversation in the House and hoping that it continues. In that vein, this has been a fabulous conversation with amazing panelists, and we hope it's one of many. We hope that we can come back and have regional-based conversations about what policy looks like in the South. We hope that we can come back and have community-based conversations about what midwifery access looks like for Black families and Indigenous families, for queer and trans families. You know, all of this work is in development and it all deserves its own time. And we look forward to having those future conversations with you. As we wrap, I'll drop a couple additional things in the chat. Birth Center Equity, you can find us at birthcenterequity.org. You can also find us on Instagram and our new TikTok at Birth Center Equity BCE. We still have a couple fabulous events for Birth Center Week, and we will archive this video and many of the events that have happened this week on that website. And you can check that out at birthcenterweek.org. I want to spotlight a fabulous event happening tomorrow with the Southern Birth Justice Network called What Does It Mean to Birth with Justice? That's going to be a fabulous event happening tomorrow. You can still register. And for our partners at Black Mamas Matter Alliance, you can find them at blackmamasmatter.org and on Instagram and Twitter at Black Mamas Matter. You can also find Sister Song, Elephant Circle, the National College of Midwifery in all the places. And if we do follow up for this event, we'll make sure that we send them out. Yes, thank you for that event registration, Julie. And yes, we just want to thank everybody so much for joining us. We had a fabulous time with you and look forward to the work to come. Thank you all.
Thanks, everyone.
Thanks, everybody.